Hello and welcome to JAMA Network Open Live. I'm Seth Truger, Digital Media Editor at JAMA Network Open. Of course, if you're following along live, send us your questions or comments on Twitter at JAMA Network Open or in the comment box on Facebook or YouTube. Today, we are going to be talking about the completion of advanced directives and documented care preferences during the COVID-19 pandemic. And we've got first author, Dr. Katie Ariema with us. Welcome, Dr. Ariema.
Hi, thank you so much for having me.
Great. Really glad you could join us. This is a really interesting paper. Tell us a bit about who you are and why you did the study.
Sure, I am a pulmonary and critical care fellow at the University of Pennsylvania, and we decided to do this study in the context of noting the obviously very high mortality and high morbidity of COVID-19 as it has swept across our country. And a lot of conversations have been happening sort of just, between colleagues about the need for advanced care planning. There have been a couple of papers that had come out basically as almost like a call to action in the lay press and in some of the academic journals saying that like doctors, like we have to sort of start encouraging this. And knowing that we had this tool at Penn of Our Care Wishes, which is this online advanced directive platform, the thought was, why don't we look into that and see whether or not patients on their own have been increasing uptake? And so basically the idea was to figure out whether or not in the course of COVID-19, we'd seen a change in the demand for our website.
That's interesting. I've definitely heard I think some chatter and some anecdotes about, more people, especially healthcare providers, filling out more advanced care directives. So what did you do in the study?
So what we did was we looked at the number of monthly users in a pre-COVID period, which was basically the 13 months prior to January 31, 2020. And then we compared that to the first 3 months of data that we had since the United States declared COVID-19 a public health emergency. And relatively quickly, it was like, wow, like the use on this website has gone up dramatically. We basically saw a 5 times increase in the number of monthly users in the pre-COVID era relative to the COVID era.
Yeah. Yeah. And I mean, if you just look at the figure, I don't think you need to do fancy math. This is my favorite kind of study where you don't need
Yeah.
stats. You just look at the figure and, there's, was it 13 months of data beforehand with a nice median of, I think it's 31 users per month. And then afterwards, there's only 3 months. So you don't need a median to describe it well, but it shoots up to, I think it's 82, 154, and 246 per month total. That's a huge increase.
Exactly. Yeah. And so just right then and there, you can kind of take one of the big findings, which is just that demand for advanced care planning went up. We then did a couple other things where we looked at how completely people filled out the advanced care planning modules on the website. And we also found that in the COVID era relative to the pre-COVID era, people filled out advanced directives more completely. They filled out a greater number of these optional goal setting modules than they did in the prior period.
Yep. Yeah, and you reported in the table a whole bunch of different, I guess, advanced care options is probably the wrong word, but modules. Sorry,
Sure.
I don't have the right vocabulary here.
Either of those work.
But as far as care preferences, it looks like things were pretty stable across time with some minor differences. But can you talk about what you found there, or any differences that were interesting to you?
Sure. Basically what you're saying is about what we found. So, we were looking at, there are a number of different modules. So there's 9 different modules on the site. And within each of those, people can select a number of different either priorities or goals or preferences. And so lots of different things that we're looking at. And so we saw a couple small differences in the pre relative to the COVID era. But because we were looking at so many different things, it's hard to know if any one of those was really truly different. But I would say the main takeaway is that essentially the documented preferences were mostly unchanged. There was no dramatic change in what people were putting in their advanced directives in the COVID era relative to the pre-era, which I think is an important thing in that patients seem to be perhaps were more motivated to complete advanced directives, but the pandemic of COVID-19 wasn't changing people's preferences.
Yeah. Interesting. I'm curious, was there anything like more, I guess, PR or marketing or publication of what you were doing with the options for the website, or trying to get people enrolled more, or
That
was
is
this
such it's a really great and important question. And no, the one of the key, I think, ways that we can interpret our findings and at least sort of wonder that they're mostly driven by COVID-19 is that there was no concerted effort either on the part of the website itself or on the part of the University of Pennsylvania healthcare system, which the website isn't only for Penn. Anyone can access it. Anyone in the world can access it and use it. But it certainly is built at Penn, and so no increased marketing for the website in any way during the time period.
Well, you beat me to what one of my follow-up questions is going to be. But from a I guess methods point of view, it's interesting to me because I feel like in some ways, like, oh well, if it was just marketing or awareness, that's a little bit different than organic growth. But at the end of the day, it doesn't matter where it's coming from. If there's changes in advanced care planning, around the time of the pandemic, there's changes in planning around the pandemic. Like that's either way it works. It doesn't matter whether it's kind of primary or secondary, but if it's kind of organic, that's certainly I don't know, interesting.
Yeah, no, I agree with you. And certainly if one was looking at the study from the lens of, trying to increase dissemination or adoption of advanced care planning tools, knowing if we and when we had put in interventions would be helpful. And, as we think about what we might do next with this, like looking forward, I think there have been or there are on the horizon plans to perhaps try and increase the site, or maybe we'll see that there's a giant uptick after today.
Right. Yeah. And I don't mean to do this as marketing, but you said it is open to everybody. Do you have any sense of how many people are local or getting referred, from your physicians or other providers?
Great question. We have I would say, rough sense that most of the participants who use the site are Penn patients, but we can't actually quantify that very rigorously right now. But that is something that we would be interested in maybe doing down the road.
Okay, I'm curious. Oh, go ahead.
I was going to say part of it is that when people fill these out, they don't have to include their zip code, right? So we don't totally know for sure where some of the people are from.
Yeah, and you probably know more about this than I do, but some states have very specific forms or requirements. Is this a generic form, or is it something that's specific to each state, or that's admissible, or I don't know what the right word is, but binding in each state?
Great question. So the format of the website is essentially like the part that is most directly parallel to a traditional advance directive is the option for someone to identify someone who would be a healthcare power of attorney. So identify a loved one who could help make decisions for them if and when they were unable to communicate those wishes themselves. The website allows patients to send this information to whomever they want. It allows them to print it. It allows them to access it remotely. Depending on the state that you're in and what the rules and regulations are there, some states are much more restrictive than others. And so you might actually, in order to have this be like a legally binding document, you might actually have to follow up with additional steps. But the main purpose of this was to allow that communication of these wishes and preferences and identification of a person. And so it at least makes that step, but recognizing that there might be other leaps for people after the fact, depending on where they live.
Well, that's good. And as a very amateur behavioral economist, I think also like having just like those little bits of friction removed, the fact that people are like motivated and started seems to be an important first step. Going to welcome Stephanie Jansen, who's joined us as well. Welcome, Stephanie. We're talking about advanced directives during the time of COVID. And again, if we show the figure, you can see just how much just at this one website, mostly from Penn, how much advanced directive completion has gone up per month since the pandemic started. So again, some other kind of basic data from your study. There were a couple little differences between the groups before and after. It looked like on average, the enrollees were slightly healthier and slightly younger. Also, Dina USA has joined us. Welcome, Dina. Anything you can speak to that, or is that just, you're looking at a bunch of patients, so numbers are a little different?
Yeah, I found that to be pretty interesting. So the difference in age was actually the difference in the mean age was actually quite minimal. I think it was like a difference of like a half a year or a year, maybe 2 years, something like that. But this general sense that people were younger and the finding that their self-reported health was better. This is pure hypothesis because we don't necessarily know this to be true, but it did make me wonder if it's bringing advanced care planning into the minds of people who may otherwise in prior times not have been thinking about it, like COVID-19, right? So as we read more about young people who are facing this very mortal and devastating disease, like perhaps people who otherwise hadn't thought about advanced care planning are thinking that maybe it is appropriate for them as well.
Yep. And something that I think a lot of physicians have talked about, but doesn't get a lot of discussion is, we talk about a lot. It's easy in the context of a pandemic like this to talk about the mortality rates, just how many people are dying. but how many people are spending, on average, it's something like 2 to 3 weeks in ICUs. This kind of advanced care planning makes a big difference. If you're going to be intubated for an event for 2 or 3 weeks, if you're, tube feedings and things like that, it can just be, these are really important things beyond the death rate. And I don't know. El Rover 16 has joined us as well. Welcome. Sorry, anything about that? I don't really have a great question on that. But.
Oh yeah, no. I mean, I absolutely agree with you. I think that is one of the things that I think advanced care planning. So beyond just sort of this idea of like, would you want to go to the hospital? Would you not? Would you want to be intubated or not? I think COVID-19 has, for lack of a better word, provided this opportunity for people to talk about the type of medical care, the intensity of it, the aggressiveness of it that they would be willing to go through for a shot at getting better. And then the question is, what does getting better look like? Because not only are we seeing that people have these long recoveries in the hospital, we're starting to see more and more that people have, residual and persistent symptoms beyond leaving the hospital. And so thinking about what type of care might fit in line with people's preferences and values and what they'd be willing to go through, I think is really important.
Yep, absolutely. I think it's a great point to finish on. Again, this is a really fantastic study, which is unfortunately still very apt right now. I think we're very far from being out of the woods here. But thank you for this great study, and thank you for joining us. Of course, if you're following along, you can get this paper and more at jamanetworkopen.com, where everything is free to access. We have new papers coming out every weekday morning at 10 a.m. Central Time. And join us next week. It was that the July 28th at 3 p.m. Central again for JNO Live. Take care. Stay safe.